My name is Jeremy Verhines, psychiatric nurse practitioner here at Lido Wellness. So what do I do different to make my work so effective? Um, you know, my approach in the care that I provide patients is tailored to who they are as a person. I mean, I don't I don't take a patient and bundle them with, other patients, compare them to other patients. I really try to dial in who they are as a unique person. I think it's important as a provider of healthcare, especially somebody doing medication management, is you don't chase like the diagnosis, you don't chase the label, but you chase the symptoms. And everybody presents with different symptoms. Anxiety looks completely different from one person to the next. Depression looks different from one person to the next. Bipolar presents itself in many different ways, not just mania, not just depression, but unique to that person. So that, like, for me, that's my goal. My goal is to really discover what symptoms that person is having. For a provider, there's also, a tendency to want to, pre-qualify a patient for a diagnosis or pre-qualify a patient for a medication. And I think this is where a lot of people go wrong. Obviously, I'm not a know-it-all or anything like that, but I almost never do that. I almost never sit there and pre-qualify a patient for a certain diagnosis or for a certain treatment. I always go by what they tell me. I mean, if they're the best historian of their own illness, I'm just somebody trying to gather as much information as possible, really try to, to dial in effective treatment that's going to be the most effective to help them through their journey.